Hi, my name is Campson, and this is actually my second blog. I'm a sickle cell patient, and I'm trying to raise awareness because this last hospital visit that I had, it really scared me, and I didn't think I was going to pull through. My family didn't think I was going to pull through, so I want to raise awareness because I notice how many people in the medical profession, how much about sickle cell they don't know. I got a PICC line put in, and this is a power PICC line. This PICC line is the best PICC line to have if you're a sickle cell patient. The regular PICC lines are usually too small for some of the tests that we may need, and even for getting our blood transfusion. Sometimes they don't. It takes too long because the PICC line is too small. So the power PICC line, if you ever have to get one, is the best PICC line to get. They took my portacath out. Removed my portacath from here on 4th of July, and they did it without any anesthesia, and I've had it done before awake just with local anesthesia, but this time I could feel everything. I could feel them cutting me. I could feel them when they were lasering, which is basically pulling the skin back together. When they stitched me, I felt everything, and they didn't give me anything for pain. They didn't give me anything to calm me down or ease the pain. So I went through that surgery without having a line in me first. They didn't put my PICC line in before I took got my portacath taken out. They actually put my PICC line in 7 hours after I had my portacath taken out. So I went 7 hours without any IV fluids. I couldn't get my IV antibiotics. I couldn't receive my IV pain medication. I couldn't receive my IV nausea medicine. So I threw up for 7 hours straight. I was having nausea and vomiting, excruciating pain. And you could just imagine how bad it was with 103 fever. I had 2 types of blood infections, so I was on 2 types of antibiotics, and I missed both of those, and it was just really hard. And I learned, how much is not known about the illness, not just in, everyday people, but people that work in the medical profession. So that is why I'm exposing what I go through. I'm exposing my struggles. I have a great doctor. Thank God for my doctor, because without him, I don't know, what I would do. He's really been a blessing to me. But I'm just trying to raise awareness. I lost 5 friends in the past 4 years. None of them were over the age of 29, and I'm 28, so it's a blessing. They told my parents that I would die by age 13, and I'm still here, so I give God the credit, and I try to take care of myself as best I can. Extreme cold or extreme hot weather causes me to go into crises. Infections, of course, cause me to go into crises. Stress can also cause me to go into crises. And the sickle cell crisis is a period of pain that we have. Pain and sometimes fever is associated with it. It's not easy. A lot of people think this is, like walking in the park. One of those diseases, kind of like asthma, that you could potentially grow out of, but there's no cure and there's no growing out of this. You have to deal with this for the rest of your life. It's very painful. It's been compared to people that have leukemia, but we're not treated as if we have pain. I've had some medical professions that treat me as if my pain wasn't real, and I just want a pain medication. So that's the ugly side of sickle cell that no one talks about, but I'm talking about it because it needs to be addressed. I appreciate you coming to my page and checking this out. And if you didn't know, African Americans aren't the only people that can get sickle cell. Indians, Hispanics, Mediterraneans, Italians, anybody of the Greek origin, anybody with melanin in their skin, of brown skin tone, no matter where you're from in the world, can have sickle cell, and that's how it works. Caucasians, white people, Europeans are the only ones that can't get sickle cell. So educate yourself. That's the only way that we have of protecting ourselves, and this disease can be prevented. If you're married with someone or dating someone that has sickle cell trait and you also have sickle cell trait, then your child is going to have what I have. And I would hate for my worst enemy to have to go through what I go through. That's how bad it is. So I appreciate you coming to my page and listening to me and just raising awareness. And have a blessed day.